My name is Clint Parker. I actually had a complete labral tear on my right shoulder. It happened from dislocating my shoulder on a motorcycle race.
Clint Parker is a 28-year-old professional motocross driver who had an accident and injured his right shoulder while riding his motorcycle. His description of the accident sounded like he had a shoulder dislocation or a partial shoulder dislocation, and then the shoulder spontaneously reduced, meaning the shoulder came out of the socket and then went back in on its own, either part of the way or all of the way.
Well, I initially started with a doctor in Bedford, and I wanted referrals to specialists for a shoulder. And I knew that I had special circumstances that I wanted to work around with a work schedule and racing schedule, and I wanted somebody that I thought would really tune into my athletic needs and needs for the future, so that led me to Dr. Farrell. With Dr. Farrell, it was very nice to work with someone who would allow me to continue to do some of the things I wanted to do while I was still injured, but also be very realistic on what the cost could be of doing that. I was able to postpone my surgery to a time that it fit my schedule better, both personally and with my racing schedule and sports schedule. So it was really nice to work with someone that tuned into my specific needs and worked with me to find a successful time for the surgery.
So given the fact that he'd been having 10 months of right shoulder pain, he had had a period of activity modification, and really on physical exam he had good range of motion and he had good strength. There really wasn't a role for any physical therapy at this point. We went ahead and got an MRI of his shoulder. The MRI did show a tear of a structure called the labrum. And so if you think about the shoulder as a ball in a socket, and the ball is the top of your humerus, and the ball sits in a socket, more like sits on a socket, if you will. The shoulder has been likened to a golf ball sitting on a golf tee. And this structure called the labrum is like a little gasket that goes around the socket, and it helps hold the ball into place. If we look at this drawing here, we can see the top of the humerus, and there's the humeral head, and again there's the socket, which again in the shoulder is relatively flat. And this is the structure that I'm referring to called the labrum. And typically what often happens when you dislocate your shoulder is the ball will come out of the front and it'll knock the labrum off. And in that setting, frequently patients go on to develop instability.
So before the surgery, I was very detail-oriented. I wanted to know all the ins and outs of the procedure itself, where I was at today with my range of motion and my strength, and where I could get to after the surgery. I was very apprehensive about coming back to full strength. Through working with Dr. Farrell, he was very encouraging that I would be able to get back to full strength if I worked at it, and thankfully that's what happened.
So at this point we had a long discussion about treatment options, which included continued activity modification, physical therapy, and we discussed surgery. And the surgery that I thought would be successful for him would be an arthroscopic labral repair, which is arthroscopic means that it can be done through just some small poke holes around the shoulder where we utilize a camera and various instrumentation. And the idea is when the ball knocks the labrum off, we want to get that labrum back up onto the face of the glenoid, that's the socket, and tie it down, and also incorporate some of the ligaments that get stretched out in the front of the shoulder when that dislocation happens. Clint decided that he wanted to go through surgery, and his surgery went very well. After surgery, he was in a sling doing physical therapy for about 6 weeks, and he's done very, very well.
Through working with Dr. Farrell and my physical therapist, I was able to get back to full strength and regain normal activity within 3 months of the surgery. If I had a friend that had a similar injury to mine, I would have no hesitation to send them to Dr. Farrell. He would be very fair in evaluating their current injury and give them the correct outlook, I feel like, moving forward. He will not push someone into surgery if he feels they do not need it. Actually, one of our first conversations was, do I really want this surgery? Because I was really at a spot where if I didn't have some of the extreme sport-type athletic movements in mind, then I really didn't need the surgery. But with a successful surgery like I was able to have, I'm now back to 100% range of motion and use, and even stronger today than I was before I had the surgery.